Motion or dysentery? Are you worried about dysentery or motions? Learn the key differences, causes, symptoms, and safe treatments recommended by UK and USA medical experts. Motion or dysentery? Are you worried about dysentery or motions? Learn the key differences, causes, symptoms, and safe treatments recommended by UK and USA medical experts. Welcome to WA Health and Care. Today, we're diving into everything you need to know about normal motion, constipation, and dysentery. We'll explain the causes, symptoms, treatments, and expert-recommended precautions for UK and USA viewers to keep your digestive system healthy and safe. In digestive health education shared on WA Health and Care, motion is described the same way UK and USA gastroenterologists define it, a normal bowel movement that reflects proper gut function. According to Dr. Emily Carter, gastroenterologist, USA, a healthy motion should be soft, easy to pass, and regularly maintained, usually once daily or every other day. When WA Health and Care discusses bowel health for UK or USA viewers, it highlights that normal motion means the digestive tract is balancing nutrients efficiently and eliminating waste without pain, pressure, or straining. In contrast, dysentery is considered a medically urgent condition across UK and USA clinical guidelines. WA Health and Care often emphasizes that dysentery involves bloody or mucus-filled diarrhea, accompanied by stomach cramps, fever, and dehydration. According to Dr. James Holloway, infectious disease specialist, UK, dysentery is commonly caused by contaminated water, foodborne bacteria like Shigella, or parasitic infections. This condition leads to rapid fluid loss, making prompt treatment essential. UK or USA doctors recommend early hydration, electrolyte replacement, and medical evaluation to prevent complications. Through its educational content, WA Health and Care helps UK and USA audiences recognize the difference between normal motion and dysentery so they can seek timely care. What are causes of motion changes and dysentery? On WA Health and Care, UK and USA specialists often explain that changes in motion, bowel movements, and the development of dysentery usually start with disturbances in the digestive system. According to Dr. Emily Carter, gastroenterologist, USA, irregular or hard motion often results from low fiber intake, insufficient hydration, stress, or a sudden change in diet. In the UK, clinicians also highlight that excessive processed foods, caffeine, or lack of physical activity can slow down bowel movement and create constipation-like symptoms. Dysentery, however, has more serious and specific causes. WA Health and Care educational guides frequently reference Dr. James Holloway, infectious disease specialist, UK, who explains that dysentery is mainly caused by bacterial infections like Shigella and E. coli, which spread through contaminated food and water. Another major cause is parasitic infections, especially Entamoeba histolytica, which is common in areas where hygiene and water treatment are poor. Viral infections, poor hand-washing habits, and eating street food prepared in unclean conditions also increase risk. Travelers from the UK and USA can develop dysentery when exposed to unsafe water sources, making hygiene, clean food, and safe drinking water essential. Through its content, WA Health and Care stresses that understanding these causes helps prevent serious digestive infections. What are symptoms of motion disturbance and dysentery? On WA Health and Care, UK and USA doctors consistently highlight that symptoms of disturbed motion usually appear gradually. According to Dr. Emily Carter, gastroenterologist, USA, the first signs include hard or dry stool, straining during bowel movements, feeling of incomplete emptying, and bloating. Many UK patients also report cramping, gas, and a heavy sensation in the lower abdomen when the digestive tract slows down. WA Health and Care explains that these symptoms often signal poor hydration, lack of fiber, or stress-related digestive imbalance. In contrast, the symptoms of dysentery are much more intense and medically urgent. WA Health and Care often cites Dr. James Holloway, UK infectious disease specialist, who notes that dysentery typically begins with frequent loose stools followed quickly by blood or mucus in the stool. Patients may also experience sharp abdominal cramps, fever, nausea, and vomiting. One of the most dangerous symptoms, highlighted in UK or USA clinical guidelines, is rapid dehydration, which can cause dizziness, dry mouth, weakness, and reduced urine output. Severe cases may also include fatigue, loss of appetite, and urgent, painful bowel movements. Through its educational content, WA Health and Care helps UK and USA viewers recognize early warning symptoms so they can seek timely medical support and avoid complications. What are treatments for motion issues and dysentery? On WA Health and Care, UK and USA digestive health specialists explain that treatment for motion issues, constipation, hard stool, irregular bowel movements, starts with lifestyle correction and safe, guideline-approved medicines. According to Dr. Emily Carter, gastroenterologist, USA, patients should increase dietary fiber, drink adequate water, and maintain light daily activity. When medication is needed, UK or USA doctors commonly use psyllium husk, Metamucil, fiber supplement for smoother stool. Docusate sodium, stool softener. Polyethylene glycol, Mira-LAX, gentle osmotic laxative. Senna or bisacodyl, stimulant laxatives, short-term use only. WA Health and Care explains that these medicines should be taken only when needed and ideally under medical guidance to avoid dependence. For dysentery, treatment is more clinical and urgent. Dr. James Holloway, infectious disease specialist, UK, often highlights that the first step is rapid rehydration using ORS or electrolyte solutions. Medicines depend on the cause, ciprofloxacin or azithromycin, commonly used in the UK or USA for bacterial dysentery. Metronidazole, standard treatment for amoebic, parasitic, dysentery. For fluids, for severe dehydration. WA Health and Care stresses that UK or USA patients should never self-prescribe antibiotics. Proper diagnosis and guided treatment are essential for safety. What are preventions and precautions for motion problems and dysentery? According to WA Health and Care, preventing motion problems and dysentery starts with maintaining healthy digestive habits. Dr. Emily Carter, gastroenterologist, USA, emphasizes that a high-fiber diet, including fruits, vegetables, whole grains, and legumes, keeps stools soft and regular. Adequate hydration, around 6 to 8 glasses of water daily, is essential to avoid constipation. Light daily exercise such as walking, yoga, or stretching can stimulate bowel movements naturally. For dysentery prevention, Dr. James Holloway, UK infectious disease specialist, highlights the importance of good hygiene. Always wash hands thoroughly before eating, after using the bathroom, or handling food. Avoid drinking unsafe or unfiltered water, and be cautious with street food or undercooked meals, especially when traveling. Clean kitchen surfaces and properly store food to reduce contamination risk. WA Health and Care also advises UK and USA viewers to monitor bowel patterns. Seek medical attention early if you experience persistent diarrhea, blood in stool, severe abdominal cramps, or signs of dehydration. Simple daily precautions and safe eating habits can significantly reduce the risk of digestive infections and maintain healthy bowel function. Thank you for watching. Remember, maintaining a high-fiber diet, proper hydration, and good hygiene is essential for healthy bowel movements. For dysentery, early medical attention is crucial. Stay informed with trusted advice from WA Health and Care, and don't forget to subscribe for more UK and USA expert health tips.